Hi. Um, Today is Wednesday, January 15th, 2025, and it is 1.
Are we,
Cynthia, I think Susan's first.
Never mind.
sorry, Doc.
Well, I did it for you.
Thank you. Everybody ready to get started? All right. Good afternoon. Today is January 15th, 2025, and the time is 1 p.m. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Infrastructure Committee. As a reminder, some of our committee members may also be participating by video conference, so staff will be managing video and audio feeds of participants closely to make sure we have a legally compliant meeting at all times. Thank you, staff. Manager Musaitif is online. The first item of business is public communication. We'll be taking public communication for the Infrastructure Committee and Strategic Planning Committee meetings in this session at the same time. Members of the public who wish to make comments virtually during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 11:30 a.m. today. Yesenia, did anyone register to make comments for the Infrastructure Committee and Strategic Planning Committee meetings? I'm asking Yesenia as if she's here. Okay. Thank you, Brianna. No, we don't have anybody signed up for communication, and we will proceed directly to the committee agenda. Item 1 is review and approve the minutes of the August 7 and October 28, 2024 Infrastructure Committee meetings. We have a motion from Manager Jones for approval of the minutes. Second from Dr. Brinson. All in favor? Or do we have any discussion? All in favor? Aye. Any opposed? Anyone abstaining? All right, so it's unanimous approval. Agenda item number 2, discuss Central Health owned or occupied real property and potential property for acquisition, lease, or development in Travis County, including next steps in the redevelopment of the Central Health downtown campus, administrative offices of Central Health Enterprise Partners, and new developments in eastern Travis County. Stephanie McDonald will be presenting, and I believe that we'll be going into closed session for this portion of the discussion. Shall I read the closed session
Yeah,
note?
if you're gonna
Okay,
go
I announced the committee is convening in closed session to discuss agenda item 2 under Texas Government Code 551.071, consultation with attorney, and Texas Government Code 551.072, deliberation regarding real property.
Brianna, do you have the presentation? Great, thank you. Perfect, thanks. Well, this is exciting. We are.
Do I need to
Oh,
announce
yeah.
the date and time yet? It's January 15th, 1:37 p.m., and we are on agenda item 2. Back to Stephanie.
Thank you. Brianna, if you'll go to the first slide for me. This is exciting. We are nearing the end of the Del Valley Health and Wellness Center construction. We believe that, well, right now, I have some really good news that we have a full-time provider starting in Hornsby Bend I believe next week or by the end of the month. Dr. Waterman, who had been going or has been going to Hornsby Bend in addition to Barbara Jordan and the Del Valley Employee Wellness Clinic, will transition full-time to this site. We also have another, we have a PA that we recruited, is coming to us from Florida. We gave him a tour and he decided to come, so I think it's a nice space. He's excited about it. So we are anticipating taking, February to get everything set up. First patient either end of February or early March. And we've got the lots of, it looks really good. There are lots of things that we are trying to kind of finish up, and I think we'll get the fire marshal out there by the end of the month to get a certificate of occupancy, hopefully. So happy to answer any questions about that.
Will we get a tour?
Absolutely, and I will share with you that we want to get the site up and running. We want to make sure that we can get all the services. We're putting in, for example, a robotic pill dispensing machine at the end of this month. Just make sure that we've got it all working. And then, but probably we'll do an official groundbreaking event. I'm sorry, not groundbreaking, grand opening event later on in the spring, maybe sometime in May, just to make sure we can, get the word out, get it going, make sure all the providers are comfortable and the team is there. But we will absolutely be able to give you a tour as soon as we can get a CO. I'm happy to try to schedule you all out there in advance of some sort of official event.
Yeah, another quick question is, in light of the challenges you went through with Del Valley,
Yes,
And
remember
in-
we are in open session.
I won't get into the specifics, I'm just saying, look, given that we're looking at Colony Park,
Correct.
are we looking at strategies to ensure that those things do not happen as we go through Colony
Absolutely.
Park?
Absolutely. And
Cool.
I have some exciting update if you haven't seen it on Colony Park too.
Okay,
Yeah.
thanks.
Dr. Martin, did you have a?
I just wanted to thank you for the work. I went by there. It's really pretty. It's really well designed and well thought out. So kudos to you guys. It's really nice.
Thanks. All right.
And,
Oh, sorry.
and I just want to thank the public that came forward and convinced us to take action and expand into the Eastern Crescent. So, thank you to the public.
And really kudos to the CommuniCare folks for being able to, we are filling a lot of positions and trying to make sure that we can get the Hornsby Bend site, I think right now, the intention is every day but Wednesday we'll have clinic services. So, next slide for us. We are actually on track on the CEC medical respite on that ground floor. We have the Lawrence group working on, using that existing floor plate as much as possible, trying to do as little as we can to get patients in the medical respite program in as soon as we can. And I just want you to know that that is moving forward and looks like it is on track right now. Next slide, please. Hancock, how many of you have driven by Hancock and seen all the work? It's looking pretty good. I drove by on the upper deck today and I was really astounded. There was a bunch of workers on the roof. It was exciting. So we are, of course, working very aggressively to try to meet some of those timelines. We can transition services into that site. And then next slide for me.
One question on Colony Park,
Oh, here we are.
not Colony Park, I'm sorry,
Hancock.
on Hancock, you said you're working to meet the timeline, which is what?
Well, there's a very significant timeline. We need to make sure we have vacated the David Powell site, which if you remember correctly is now technically TxDOT property, and they have allowed us to stay. They're allowing us right now to stay through April of 2026. And so we would like to be out of that site and into this site for maybe just that service area, that clinic and those service lines. We do know that we need to have lab and pharmacy ideally up and running too. So we're really concentrating on the ground floor and really in that quadrant where those services, and we may have to, for example, delay dental, which is in kind of that northeastern quadrant, to prioritize really making sure that we can transition David Powell out. That's the primary
So
focus.
April 2026.
Just for
Just
that.
for the
Yes,
David
the
Powell.
rest, I think overall, the entire building, we are saying substantial completion December of '26, with potentially a transition of, the administrative function, potentially these meetings in the spring of '27.
Okay, thank you.
Any other
Alright.
questions?
Yeah. Any other questions about Hancock? Colony Park, the team has been busy working on Colony Park. This is the first glimpse at these are really kind of exterior renderings. We're working, there's a challenging topography. This site kind of backs into a hill. We're trying to make sure we have appropriate parking. So right now it looks like in order to facilitate the needs and the service lines, including having a drive-through pharmacy, that this site will be stacked. The kind of lowest level is going to be an adjacent to potentially parking in a kind of structured deck situation. The lower deck would be the pharmacy and lab, so you could drive through if you needed to pick up some prescriptions. You could also park and go into the building on this level, get any lab services if you, usually our lab services are provided by an outside vendor, so it really allows for them to kind of be in that space, and potentially at hours that are not the same as the clinic. Then if you go to the street level would include kind of the community floor. We are envisioning a multi-purpose room that might go out to a patio space similar to the Southeast Health and Wellness Center. We are really looking at a commercial kitchen for the first time. We have kind of the demonstration kitchen at Southeast. This would allow us, I think, a lot more flexibility in how we could use that for either medically tailored meals or potentially a workforce development with a nonprofit partner and a community partner. So I think really trying to make sure that that's adequately sized as a food access point potentially. All of these are things, in development, but I think we really want to make sure that that's sized appropriately, walk-in cooler, et cetera. And then also, this is the floor where we would have community services and eligibility offices. You could come in, get your MAP card here, but also, this is where we would do, Pat gives me a lot of grief about diapers and how excited I am about them, but, all the other things that we do from our community resource standpoint, and the community health workers that help us, with those wellness programs and other community services with our partners, including Central Texas Food Bank, Foundation Communities. So this is, for the future, this is kind of a pretty large site. And then right now we are allocating space for Austin Public Libraries on this floor as well, to have a kind of 3,000 square foot pop-up library that may be in place until there is a more permanent solution in the Colony Park community. And then on the essentially the third floor, the upper level, would be the clinic, which includes dental, primarily focused on adults, and general practice primary care. We are exploring some other things around potentially, they do limited vision screening at community care. So just making sure we have, appropriate clinic space up there. And then, because of the staff nature, we will have lots of elevators, also, appropriate stair access, hopefully for both the public as well as staff. So we don't have a clear date. We'll know a little bit more, and I'm gonna just tee up that our existing project budget, which I think was done about 4 years ago, conditions have changed, and this building has now become more robust with a parking deck. So please be aware that we will come back probably with a revised project budget and an ask from you all. Jeff is aware that this is coming.
Manager Valdez?
Is there gonna be, I don't see a playground. Is there a playground at this facility or not?
There is not, it is adjacent to the park.
Yes,
So it should have a pathway at some point up the hill to both, hopefully both the swimming pool as well as to the park.
I didn't remember whether or not there was anything for physically challenged children or adults.
I
And I was
bet.
wondering if maybe we could donate something
At that
to
playground,
to that park, yes.
at the park, let me look
If
into
there-
it. I'm
yeah.
not sure if we
'Cause
can
most,
donate.
most
but
parks don't,
I
think about
know,
that.
But I will share with you, that's one of the best parts about the Hornsby Bend
yes, I know.
clinic is
Yeah.
the playground is so actively loved. But I don't know that we can donate. I'll have to figure out, and then working with the city, I know that's an established park space. So let me just see what we can
Thank
find
you.
out and get back to you. Yes.
Thank you.
Yeah, I think it's important. Thanks very much. I appreciate it. And I appreciate the patience you've had in working through Colony Park. I know it's been a while, as well as the other ones. I think it's important, though, that we do engage the Colony Park Neighborhood Association in the nuances of the changing of dates, time, locations, where possible. Also, as Manager Valadez said, there's a strong relationship between the park and that neighborhood association. So I would encourage us to be able to, maybe on a certain frequency, go out and meet, talk with, encourage, let them know where we are on that. And one thing I thought we were talking about is a walkway. This was when we were considering perhaps APH having some component with this, and I think that's gone away now. But a walkway where people who actually have been referred by their doctor to get exercise and other things could walk up to the playground where there's a gym and other things. So I'm not sure if that's still part of the plan
I
or
think
not.
there is a pathway
Pathway,
that is
yes.
planned. It's not on our property, but I think the city is very much looking for ways to connect this site as it backs up into that hill to the swimming pool and to the park. And this is really just conceptual massing renderings
Right,
right
right.
now. We do participate in the core team meetings. I know you do as well, right? So we are giving updates and working with our city colleagues at those meetings. And we do meet regularly with the Financial Services Department, the formerly Economic Development team on this site. So as we get further, we do know, we are still really right now just trying to figure out the site itself.
Okay, because this would be the only, and correct me if I'm wrong, the only health center in that part of the city outside of that in Maine, part of the county outside of that in Manor, within the northeast area. And so this is a very important and critical site.
Absolutely.
Sooner the better.
Yeah.
Thanks very much. I appreciate your help and support in getting this moving along.
And then last slide.
And Stephanie, so did you affirm that we are already engaged with the neighborhood associations in PARD? Okay.
We meet in that regularly.
Okay.
Yes. And the next.
Oh, and Dr. Lee?
Oh, I'm sorry.
Sorry, just a couple quick thoughts. First, for the record, I love diapers. Because, right, we give out tens of thousands of diapers. They are an urgent need if you're a young mother. And you may come in for the diapers, and then you may get your MAP card renewed, and the prenatal care for your next child, and primary care access. And so it is a point of trust where we meet a true need, and we provide the full range of cares that we need. So I love diapers, and I think this is a larger version of the same concept. As I understand it, this may be one of the first public libraries, also in this part of our county, which has been deeply needed. It is being planned with the neighborhood association in connection with these other community assets because health is broader than healthcare, and there's a campus notion of this, which is very important. And I really appreciate Stephanie's leadership. You or Yesenia are I think always there at the neighborhood association meeting, which is vital for us to do that. And the third thought is just to echo the thanks to Community Care because it is not easy to recruit a provider and a team to dedicate their efforts to serving in Hornsby Bend or Del Valley or Colony Park. And kudos to that team and the recruiters who are able to find the right mission-driven and outstanding care teams to do that, to open up that access. So I just want to make sure that was said as well.
And I'll get to you in just a second, Manager Valdez. Super echo anytime we talk about the constellation of community assets and how we can 1 + 1 = 3. a circumstance. And I appreciate Manager Jones pointing out the very, very, very unique opportunity this is to be able to invest in a way that this footprint is not just sustainable, but emblematic of the kind of investment that the region and the residents deserve and have needed for a long time. And I also very, very much love diapers, especially in the implications, particularly with Health and Human Services and how they are not just so important for young parents, how terribly in demand they are, and how terribly unaffordable they are for so many of our fellow residents, and leveraging that entry point, again, understanding the constellation of community assets, leveraging that entry point for other elements of care when it comes to human services, but also renewing those map cards, making sure well baby checks are happening, the kinds of things that set up healthcare mortality and morbidity for positive outcomes throughout the whole life. So yes, I'm really glad you pointed that out. Thanks, Stephanie. And
Speaking
Manager
of
Valadez.
diapers, let's not forget, as we tend to, babies aren't the only ones that use them.
Sure.
And we have, especially when you live in the disability population world, or the older population world, we need to make sure that we have all sizes of diapers, or because we have lots of needs in our community, and people tend to forget about the older generations or the more challenged, physically challenged components of that population. And I just want us to make sure that we are doing that, are we?
We distribute when we get them from the Austin Diaper Bank, and we also have, they provide menstrual products to us, so we distribute those as well.
I know one of the things that I do personally is I give adult diapers to a lot of families that don't have access to any services because they're not citizens. And so that things are changing after January 20th. And you may find that there are great needs that are not going to be filled or met because of strategic changes to policies and practices. So if anything we can do for all our entire population, please do it. Thank you.
Absolutely. One more slide, because I think this is the request of this committee, and I just wanted you to know, I drove by the Capitol Plaza, stopped by the Capitol Plaza Clinic on my way here. We have actually done some interior renovation work to incorporate the community care medication-assisted therapy program, have another site in addition to Southeast for that MAT program. They're setting up, and we'll see their first patient on Monday. But I think you just asked to know kind of what is happening at each site. It's exciting to see, especially that Capitol Plaza site, really still being utilized very actively as we transition services over to Rosewood Zaragoza. So any questions, I'm happy to defer to my colleagues over here on any questions on the actual service lines and where they're located.
Still push for the parking lot improvements at Capitol Plaza.
Yeah, that's a complicated one.
I know, but it's a difficult one.
It is.
Thank you.
Thank you so much. Appreciate it.
Manager, did you have any question, Manager Jones?
Yeah, before you go, first of all, I think on behalf of the board, we'd like to thank you for the hard work you and your team have done to elevate and move us along with that. I will also encourage us to consider this presentation or some part of this presentation being presented to the City County Public Health Commission. That commission has not, in my view, been very visible or very engaging in what's going on. And I think for them to see what Central Health is doing goes a long ways to let the city and county officials and other appointees know that there's a lot going on in this, and we need to be visible in those methods as well as in communities as well. So consider that they meet first Tuesday, Wednesday, I think,
I'll connect
of
with
each
Carla
month.
and see if there's an
Yeah.
opportunity there.
All right, thank you.
I have one question. Stephanie, are those services actually up and running at RZ?
Yes, they are.
Okay, good. Super, thank you.
Thank you.
Thank you, Stephanie. So we're on to agenda item 3. Our next Central Health Infrastructure Committee meeting is tentatively scheduled for April 9th, 2025. That's Wednesday at 1 p.m. Here at the Central Health Headquarters, 1111 East Cesar Chavez, Austin, Texas, 78702. I will also add that there's a high probability that we will have a meeting on the books before then, or a reasonably high probability. And with that said, ready to accept a motion for adjournment. Manager Jones, seconded by Manager May. Any discussion? You can still, all in favor? Aye. Any opposed? Unanimous. We're adjourned.
Hi. Today is January 15th, 2025, and it is 1:57 p.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Strategic Planning Committee. As a reminder, a committee member may also be participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. So, number one, review and approve the minutes of the November 6, 2024 Strategic Planning Committee meeting. Oh, yes, before we do that, since one of our members just slipped out, I would like to have Manager Jones speak to us today because today is Martin Luther King's birthday.
Thanks very much. I'd just like to take a few moments to acknowledge that today is the official birthday of Dr. Martin Luther King, who is by far one of the greatest civil rights and leaders in this nation. And I think it's something, particularly health care and public health, as well as all health, as well as economic and other development, is very critical to our nation. And he played a significant role in that. So I want to acknowledge that. Also have a personal connection that I wanted to share is that actually Dr. King was a student at Morehouse College back in 1948, and he was a student of my grandfather. I didn't know that until later in life, and he had the opportunity to tell me about some of the experiences he had as a student there at Morehouse College. And so I wanted just to highlight that as well, and to encourage us to recognize that we all are civil rights leaders in our own way. And the work we do here can make a difference in that, regardless of one's political position. So thanks for the opportunity to acknowledge it. It will be acknowledged on the 20th of January, which is Monday or Tuesday of next week, but next Monday. But that day is going to be completely surrounded with a lot of other things going on. So I wanted to use this opportunity to acknowledge that. Thanks very much.
Thank you, Manager Jones. So, number one, I'd like to review and approve the minutes of the November 6, 2024 Strategic Planning Committee meeting. And do I have Manager Valadez and second?
The committee approved the minutes of the November 6th strategic planning meeting.
And do I have a second?
Second.
Manager May? All voting, please. Okay, so it passes. Number two, receive and discuss an update on external affairs, including communications and government relations. Ted Burton, Perla Cavazos, Ivan Davila will be presenting with Dixie Cachiros from Belmont Ice House.
Everybody, and Happy New Year. Today we're going to be talking about our external affairs efforts. We're going to do an update on some of our 2024 highlights and a look ahead to what's coming in 2025. I would like to first introduce and let them introduce my colleagues here. I'm Ted Burton, Chief Communications Officer.
I'm Perla Cavazos, Deputy Administrator. Ivan Davila, VP of Marketing and Communications.
And on the line with us is Dixie Catros with Belmont, and she is their strategy and research director. And we're going to also give you some highlights from our 2024 awareness survey, which we do almost every other year. Next slide. So the mighty oak tree metaphor, with the trunk representing trust. Pat first introduced this to us, our staff, and the community and you about a year ago, and it really is foundational to everything that we do here at Central Health. And it illustrates how our external affairs initiatives branch out from Central Health, which is the foundation, which is founded in trust. Trust is critical when it comes to communications. Every day we see, and you've seen, how people struggle to trust the healthcare system, and yes, still struggle to trust Central Health. The barriers are real, and the consequences of a lack of trust are profound. When patients don't trust their healthcare provider, they might delay seeking care, they might hesitate to share crucial information that could improve their health outcome, and often they experience poor health outcomes. This is where the communications team, under the larger external affairs efforts, step in. Each branch of our work that you can see there, from content creation, community engagement, community outreach, and government affairs, grows from and strengthens this core of trust. The branches are our pathways. They connect with our community, where we share vital information and where we build lasting relationships. Any relationships that we have, that you have, whether they're personal, professional, or here at work, communication isn't just about exchanging information or pushing information out. It's about creating an understanding, fostering a connection, and building confidence. When communication breaks down, trust erodes. And with it, our ability to serve the people that are relying on us, that need us, most also breaks down. So throughout this discussion today, my colleagues and I will show you how our team's work is not just about spreading awareness, it's about cultivating trust. We're creating a healthcare ecosystem where every person, regardless of where they're from, where they live, how much they make, what language they speak, who they choose to love, they're valued, they're trusted, and they're respected. So with that, we'll kick into the presentation. I want to first, next slide, talk about how we are using content, our communications content, to humanize the Central Health system through compelling stories. These aren't always polished marketing pieces. They're authentic journeys of transformation that are happening right here in our community, thanks to many of the people in this room, thanks to you, and absolutely thanks to the people that we are honored to serve. If you haven't recently visited our newsroom on our website, I would invite you to do so. It's more than just a press release archive. There are compelling videos, photo galleries, and in-depth articles that showcase the impact of the work, the real people, and our staff that are making change in our community. And these are just some examples. On the far left, that's a story that we produced about the unanimous approval regarding Central Health's budget. The middle is a feature story written by Mike Clark Madison about the new, I believe that one's about the 20 years of Central Health making a difference in Austin as part of our anniversary. And on the right, you can see Kevin Gant. Mr. Gant was here speaking to you a few months ago as part of our transition of care team presentation. After Mr. Gant spoke to you, we immediately, Edwin Evans is over there, one of our content masters, we grabbed Kevin out, Mr. Gant, in the hallway. We set up an interview and talked to him right there, and that became a video. And Mr. Gant's story became one of those narratives that we used during our budget presentations to Travis County commissioners to get our budget and tax rate approved. So anyway, these stories, they do more than inform. We're trying to connect with people in real and meaningful ways and bridge gaps between experiences and statistics. I think the facts are incredibly important, the metrics are incredibly important, but we've got to lead with the human stories to make people really care and understand the work that we do. Okay, am I next?
Next slide.
Yep.
All right, thank you, Jed. So one of the roots of trust is consistency. And that is because inconsistency leads to confusion, and a lack of clarity can erode trust. So to build and maintain trust, our creative team develops compelling visuals and messaging that consistently shape positive experiences. And we know a seamless experiences is critical to improve our patient's journey in the healthcare system. So consistency is achieved by adhering to a set of branding and editorial guidelines. These guidelines ensure that all content aligns with our mission and our values. What you see on the left is 2 flyers. One is part of our colorectal cancer screening patient education campaign, and one that is part of our diabetes education campaign. In both campaigns, we are leveraging some of our accent colors to neutralize the campaigns and encourage our provider partners to share these materials among their patient populations. In the right, you see some of our samples from our campaigns to raise awareness of Centro Health, its programs and its services, and also our partnership with the Health Alliance for Austin Musicians, or HAM, during the ACA open enrollment period. All campaigns are in Spanish and in English, and we are translating materials to other languages spoken by our patient population, including Arabic, Vietnamese, and Burmese. Next slide. We are empowering Travis County residents to actively contribute to improving the health of our community by ensuring that those who we serve and those who represent them have a seat at the table. This approach, inclusive approach, strengthens trust as our community engagement team actively listens to and collaborates with the people that we serve, ensuring their voices shape meaningful outcomes. Some of these initiatives include what you see on the screen, and you're very well familiar with these initiatives. So for example, hosting roundtables, discussions with the CEO to facilitate authentic dialogue between leadership and stakeholders. Also, our team organizes meaningful community events designed to build strong, lasting relationships. We also produce community conversations across the county. We'll be talking a bit about that for this year's plan later on today, providing constituents with opportunities to make their voices heard, and also cultivating our health champions who advocate for and amplify the impact of our work. So that is the community engagement branch of the tree. Next is community outreach. Next screen, please. And so our outreach team is dedicated to bringing vital information and resources to communities where trust is lacking. We prioritize grassroots outreach efforts to reach underserved populations, including people experiencing homelessness and communities of color. Some of the strategies include grassroots outreach, having community health workers and ambassadors engaging directly with patients in their neighborhoods and at local events, fostering personal connections and trust. We also work with trusted local organizations, faith-based groups, and community leaders to amplify our message and extend our reach. We also leverage platforms familiar to our patients, such as texting, to effectively disseminate information and ensure accessibility. Next.
We work closely with HR to use internal communications to foster a culture. Next slide, please. Thank you. A culture of transparency, collaboration, and trust building among our staff to ensure alignment with Centro Health's mission and values. Recently, our internal communication specialist transitioned to the CEO's office, Ty Bishop, to serve as our CEO's communications manager, and Anastasia Sims, who you're very familiar with, who's been here probably 7 years, is now stepping into the role of internal communications manager. We are focusing really intently, along with our HR team, on internal communications. Some key elements would include transparent leadership communication, so communication from our leadership team, and of course Pat, our CEO, about our organizational priorities, goals, and challenges. An example of elements we'll be implementing this year or continuing in 2025 are CEO town halls. These are town halls for our staff. Our internal newsletter, The Pulse, which has about a 50% open rate among our staff, and we are making some improvements to that with a goal of, we want everybody to open, read, and understand the information in The Pulse. empowering our employees to be ambassadors for the organization. We have hundreds, now thousands of Central Health employees, and among the system, absolutely thousands. We want to equip our staff with a lot of the information that is shared in these meetings. Not everybody can attend the meetings or even have a chance to watch the meetings, but providing them with information so that they can then become trusted representatives of Central Health in the community. Feedback mechanisms, making sure that our staff has a way to share ideas, concerns, feedback in a safe and constructive environment. This would include surveys and ask leadership sessions where we can have one-on-one or 10-on-1 dialogue with staff, where again they can share ideas, voice concerns directly to decision makers. Recognition and appreciation, highlighting staff contributions, not only in formal ways through our e-newsletter, but also sharing patient stories and the providers and staff that made those patient success stories possible. So an example of that is a monthly recognition feature featuring employees that highlight Central Health values as we build trust among our patients and taxpayers. You've seen examples, and you'll continue to see examples of mission-focused storytelling. Our staff, some might get tired of hearing from the communications team because we're always looking for and seeking out these stories, but it's been really rewarding to see now they're coming to us. In fact, just this morning I got an email from Dr. Kwong. Hey, let's meet Friday. I've got a great story that Dr. Shalsha had shared regarding hoteling, people experiencing homelessness during winter storms. So I feel like that's part of our DNA now, and people want to share these stories, and I think it benefits all of us, but most importantly, our patient population. And finally, having accessible communication challenges. We have an employee intranet. No, you don't have access to it. It's for our employees. But this has really morphed into something that's almost like a Facebook for Central Health staff. So they can go to our intranet. It's mobile friendly. But if they need HR forms, information about finances, leave of absences, or just our homepage, which is now our daily news page. I think today, Manager Jones, it's featuring information about MLK celebrations for Monday. So it's really become a very robust place for people to go and seek information.
Does Zuckerberg have anything to do with it?
Sorry?
Mark Zuckerberg have anything to do with
He
it?
does not, and I will not comment.
I want to share a little bit about government affairs as well, which, you know, together we are external affairs, and I think it's beyond, I think also effectively communicating and updating our elected officials and our other government partners is really essential to building the credibility and trust of Central Health, and just also partnerships in how we, you know, collaborate to serve the people who are most in need in our community. I think as Ted said, we've really, in the past year, I think more than ever, really embraced the sharing of stories, of testimonies from patients and providers, and we've found that especially in the past year to be very effective. But a regular and consistent touch points with elected officials is something that we try to focus on as well. And as many of you are aware, because we've pulled some of you into these, we do many one-on-one meetings and briefings, especially around getting our budget approved at the by the county. And I would add to that as part of those one-on-one briefings and conversations with elected officials, we do a lot of what I would call constituent services. And as a matter of fact, Chair Kitchen yesterday, I think it was yesterday, received a call from Judge Brown about somebody that spoke at Commissioner's Court yesterday, and so we were able to get the information and respond, and we're going to be following up with that. And so we often also in those one-on-ones, usually when I hear from an elected official, it's some concern, or there's an issue with a member or a patient that they that's contacted the elected official's office, and we try to help that patient navigate. We kind of take it from there, and so it's a lot of those one-on-one touch points in addition to regular email updates, just sharing information about our groundbreakings, expansion of specialty care services, any notable updates from Central Health, sharing of our board meetings and other community conversations as well happens through communication. Of course, we're doing the work sessions with Travis County Commissioners Court, and we're committed to doing at least 4 a year quarterly. So we had one of those already in December, and we'll be doing, more in this year. We also try to get in front of the City of Austin Public Health Committee, which is a committee of the City Council, and we did a presentation to that committee in December. We'll hope to do at least another, at least 2 a year. And, we, to the extent that it's appropriate and that board managers have time, we do want to invite participation from the board in those one-on-one briefings and some of those presentations. I also want to say that we are doing something new, actually, to Manager Jones' recommendation. We are embarking on town hall or community conversations in collaboration with Travis County Commissioners. And we already have 2 scheduled so far for March with Commissioner Shea and Commissioner Howard, I believe.
Much amazing.
And we've been in communication with Commissioner Trevelyan, and I think this is a nice opportunity to also build bridges with our Travis County Commissioners and have them host, I think might be a good word, host us in their precinct with their constituents to learn more about what we're doing in the community. And I think that builds a lot of goodwill as we work towards getting our budget, updating the commissioners on what we're doing and also getting our budget approved. I also want to say, the legislature's begun, so we're also now meeting with our Travis County delegation at the Capitol. Legislative session began yesterday, so Rob Borja and I, Rob's our Director of Government Affairs and Public Policy. We're at the Capitol yesterday, just checking in with our state representatives. He and I met with our 2 of our senators from Travis County, also within the past 30 days. And I'm also, each government entity in Travis County does have what they call intergovernment relations officers or staff. And so just know that we are also communicating with our government affairs counterparts in other governments to hear what other local government partners are doing. And we're just also staying informed. So, all of these touch points are really important in helping our elected officials and government partners stay informed about Central Health. I think we're doing some earnest listening about what matters to them, and we're sharing what we're doing in relation to healthcare about serving people who are low income. I think a lot of partnerships and collaboration are coming out of these conversations that have been very productive and just have improved trust and collaboration. So we'll continue to build on that. And so I want to, next slide, talk about what happens when we build on these touch points and this trust. Oh, is there?
I don't mean to interrupt you. I just have to take off. I appreciate this. I was curious. One outreach I've not heard about is towards our tax base. And that is our, the Chronicle, the Statesman, the TV stations, that, they don't know about this stuff in the general community. And those are the people who will keep going back and asking for more money. And I just was curious about the position about that.
I can talk about that. So we are in constant communication with all of the local media outlets. In fact, there was an inquiry today from a local reporter. So our media outreach is consistent and ongoing, and we have strong relationships with reporters Statesman, Chronicle, Monitor, all the local TV
Community
stations.
impact, there was a story on
Community impact. So it's, and I hope that, and if you're not, please let us know, because we send out updates called In the News is the subject line that shows local coverage. We probably average approximately 1 to 2 traditional press releases a month where we're pushing out information. And then regarding just communication to taxpayers, in fact, and you're going to hear about, you won't hear about that, I'm happy to follow up with you afterwards, but talking about awareness, in years past, we have not focused on general brand awareness about Central Health. We've been laser focused on our patient population. So getting people enrolled in the MAP program, awareness about ACA. For this year really is the first year, with end of last year and this year with the launch of the new brand system, that we are investing specifically in some general awareness to help raise awareness among all Travis County residents about Central Health, who we are, what we do, how we're funded, et cetera. I would be more than happy to sit down with you and talk in more detail about that. But that absolutely is going to be a bigger focus moving forward. Sure.
And I'll just quickly move through the next 2 slides. I mean, really, just making a point that when you have consistent, and earnest conversations with elected officials and share the information and listen to the concerns and, and we're responsive to what they're saying, including with our community, the outreach that we're doing and with our community health champions, we are seeing an increase in community support. And we have a metric here of people who have made public comments at Travis County Commissioners Court during our budget process. We have seen a decrease in comments, people speaking, sharing concerns about our budget, and we feel that that's positive and a result of all the work that we've been doing in the community, meeting with people, hearing them out, sharing information, but also not being afraid to reach out to people who are sharing concerns and discontent and just try to understand, what is that about, and making sure they have the accurate information, or if there's an issue that, because there's something we need to fix, that we're doing everything we can.
And we've
to address that
seen
concern.
past critics become supporters.
Right,
And
right.
that's very intentional.
Yeah.
And I want to give kudos to the engagement team, which follows under Yvonne's leadership, but very strategic, intentional work, talking to both critics and supporters about the work that we're doing and having very honest conversations.
Yeah. And next slide. And then lastly, another metric is we got unanimous approval on our budget last year, and this is very special because we've only had unanimous approval, at least in the 8 years that I've been here, twice. Usually, there's some abstention or even occasionally a no vote. In 2024, we did have 3 votes in favor, 1 note against, and 1 abstention. And so, to us, I think, again, this is just a result of all the collective efforts, and not just with external relations, but also, with our CEO's office and other team members that are meeting with, having side conversations or formal meetings with elected officials and their staff and departments, other agency departments. That's
And
moving on.
if I may just amplify for a moment as we pivot here, I really do think this has been a profound year of connecting some of the dots. You called this out, Manager Jones, in the last presentation, that there is a continuity from listening to what is needed, both feedback we get and the data we get, building to the gap, which our healthcare delivery and infrastructure and joint tech teams principally do with our people, and then communicating what has been built very intentionally to our internal stakeholders, to our elected stakeholders, to our community stakeholders, to our media stakeholders, so that there is a continuity from that listening all the way through to the recognition that we've done something meaningful and made a difference. And I think we're going to always improve, but I think that this last year was really wonderful for me to see the external affairs team pulling that value forward from the healthcare delivery and infrastructure and joint tech teams and others, and translating it into these very meaningful metrics, like who spoke up in favor, who changed their position, and ultimately, I think, earning that 5-0 vote in trying circumstances. So I just wanted to thank you all. And you may recall the last branch on the tree, the One Truck Many Branches tree, is Speak to the Heart. And I think that's what this is to take all that work and speak to the heart and speak to the people that we have the privilege of serving and who represent those people. So just want to echo and offer kudos. Thank you.
Thank you, Pat. So what happens when we build trust among patients? Next slide, please. I'd like to introduce you to Steve, the first Central Health Palliative Care patient. He was seen by Dr. Owens, and right from the start, he felt cared for. And I won't belabor this point. I'll just let you listen and watch this video.
When we first met Steve, he was our very first palliative care patient. And he was just very warm, had a very warm smile. That's what I remember about him. He was just very inspirational because he just knew, despite his diagnosis and prognosis, that he was going to get through it.
Well, when I first visited with Dr. Owens and her staff, I knew right away that I was in good hands and that I was going to be taken care of. And they set the bar.
So when he came, he was carrying a lot as far as just with his diagnosis and not being able to work. And so there were a lot of barriers that he had that he was concerned about. And so, of course, with cancer, that's a financial strain. So he was worried about how he was going to make ends meet.
Any issues, my pain, they've taken care of my pain. Any other issues that came up, they've addressed, and they're right on it.
He has been able to meet his health goal as far as being able to be done with chemo. During that time, nausea and pain were some of the biggest factors for him as far as symptom management. That is something our providers were able to maintain.
I would hate to think to where I would be without without the care that I'm getting from Dr. Owens and her staff and the palliative care team. I don't even want to think about it.
So he is now also waiting to get his complete clearance from his oncologist so that he can go forth and enjoy the things of life that he enjoys.
Well, I'm looking forward to, getting better and hopefully going back to work before too long, and just getting to feel better and, having a more active, full life.
So that's Steve, and again, what happens when we build trust among patients and better health outcomes.
And what happens when you have Edwin Evans on your team?
That's right.
And a partnership with healthcare delivery.
So this shows our team humanizing the system. Now imagine the care continuum, connective tissue included ongoing communication with patients. And so this is what we're building this year. So with patient education campaigns like the diabetes education campaign, the colorectal cancer screening diabetes campaign, in close collaboration with our healthcare delivery team, Dr. Shasha, patient education team, and data analytics team as well. But how do we measure this trust building journey? Next screen, please. At first, so right now, what we can do, how we can measure it is at the awareness level, at the engagement level, tracking their resource utilization, tracking how many partners are actually sharing the information that we're sharing with them. We are conducting a pre-campaign surveys with patients to measure their understanding of a health condition. We're currently working on a diabetes education pre-campaign survey. And so then next slide, long-term future state, again, working in very tight collaboration with our healthcare delivery department and data analytics department. We will be able to track screening rates, behavioral changes, and health outcomes as they pertain to the patients that we've been communicating with. So again, in summary, what happens when we build trust with patients across the care continuum, including patient education and communications, what is the overarching result? So more healthy people, better health outcomes, and reduced disparities. Next.
Now we're going to move into, we're going to try to keep this brief, an update on our most recent awareness survey from October 2024. I'd like to introduce Dixie Cacharos with Belmont, who is their strategy and research director. Dixie, are you with us?
Yes, hello. How is
Hello.
everyone? Hope you're well. I am Dixie Cacharos, and I've worked on brand and marketing research and strategy with Central Health for about 4 years now. So I'm glad to be going over these results with you today. If you would like, I'd dive right in. And I just wanted to say a few things about the survey. As Ted mentioned, it was in October, and we surveyed 500 Travis County residents, oversampling for our patient population with a statistically significant survey methodology in partnership with the long-standing reputable Austin research firm Think Group. And we measured, again, awareness and support of Central Health's mission, perceptions, and messaging preferences. We also, in tandem with the online survey, we interviewed people by phone in languages other than English and Spanish to ensure that we captured that segment of the population, as well as those who may not have internet access. So we'll discuss the interview results following the online survey results. So diving right in, through the survey, what we found is regarding access to healthcare, an overwhelming majority of Travis County residents, 94%, agree that healthcare is a human right and that everyone should have access. This strong community support really underscores Central Health's mission to ensure healthcare equity and access for those who need it most, which is why there's a strong access to healthcare mission-centric component to the messaging in the 2025 marketing strategy. Next, we look at awareness on the next slide. Awareness is a key KPI, and we focus a lot on awareness because it's foundationally important to building trust in the organization, which of course is key to our strategy. And we know that trust is one of Central Health's core values. And we also know that communication is foundational to trust in personal, professional, and business relationships. And trust is vital for the patient journey as well. If you don't trust your provider, again, you'll be less likely to follow their direction. On the flip side, we know that if people trust us for care, they're not going to go to other places or postpone care. As you can see here, the awareness of Central Health is slightly higher than the previous waves and has increased 9% over the last 5 years. However, there's still room to grow, and our goal is to raise awareness by 4 percentage points in 2025. For MAP, we'll see an incremental increase, or we have seen an incremental increase of 1% and 3% respectively, and plan to raise this by 3 percentage points in 2025. And I want to make a quick note before we move on. This is important. Central Health and MAP are now united under our new brand, and historically MAP has had greater public awareness than Central Health. But this rebranding effort really presents an opportunity to elevate awareness of Central Health. And by increasing awareness, patients will get a better understanding that they're supported by a comprehensive system with a wide range of services. Next, we're going to take a look at awareness by languages. While English speakers' awareness did increase by 7 percentage points from 2019 to 2024, Spanish speakers' awareness increased by 26% during that same time period, 26 percentage points. A huge leap, peaking at 38% awareness, which is important as this is a key segment. And also, it means that our target audience, media approach to reach these key audiences is working well. Are there any questions so far?
I'm interested in the previous slide about awareness of central health. Did you take into account the rapid, and these are Travis County taxpayers and patients. Have you taken into account the new residents that are constantly moving in over these many years, and what impact that may have had in terms of the percentages?
That's a great question. So we definitely have reached out to, of course, those that are moving into the fold. But with regard to the increase, that's not something that we have looked into. That's something that we would need to dive deeper into.
And it's a snapshot. So this is the awareness of in October 2024, and the last one was in 2021. So we didn't do any segmenting for how long someone had lived in the county. Is that kind of what you're asking?
Well, yeah, I'm just wondering if, with the rapid growth of Austin, are residents aware that MAP Central Health even exists, and what those numbers reflect in terms of the overall population that we see here? So you don't have to answer it now. I just throw
That's
that out
definitely
there.
part of the challenge, is people that are coming here that are new, that don't have any historical knowledge or reference to MAP or Central Health. So
Which is why sustainable media, ongoing efforts around communication are super important to ensure that we are letting people know about what we offer continuously.
Okay, all right.
Great. All right, let's continue.
hang on one second, Dixie. We have one more question.
One question.
Oh, I'm
Yes.
sorry.
I was just trying to find you all on the web, and I did, but what I could not find is who exactly you are. How long have you been in existence? Because I think that goes a lot to one's knowledge and experience with what it is your clients are looking for. And so what is that? Who are you, and how long have you been in business? And what is your demographic breakdown of your founders or directors?
Great, yeah. So we will be celebrating our 20th anniversary coming up here quickly. And we are kind of, in a nutshell, we're a strategic creative shop that is compact. We don't have a holding company, it's just us. And Tim Hudson is our president. And with regard to the breakout of demographics, I don't have that on hand. We skew Caucasian, if that's what you're asking.
Yes, that demographic of who your founders are, and because that gives me a insight into what lived experience or perspective you have.
We can follow up, and also they've been one of our partners, one of several partners for probably 8 years or 9 years now, and the research firm is Think Group, and they are Latino-owned, based here in Austin, and their lead researcher has done research. Has done research for us, Department of State Health Services, a long list of organizations that serve the same patient population that we do.
I'm sorry, I think you're misunderstanding my question. So my question is, who are you? You just told me Tim Hudson is your president. Ted, you're telling me something different. It's Hispanic owned.
Not different. Belmont is the consultant.
Okay.
Think Group is the research firm that did the research for us.
Well,
and
I'm
Dick-
always
yeah.
interested in who's doing the research.
Totally fair. Happy to follow up with you
Please.
with more details. But Dixie works for Belmont, and Think Group was selected to do the research. They're Austin based. So I was speaking to the folks that led the research project.
The subcontractor?
Correct.
I get it, but I want to know who the group is.
Belmont Ice House is the group, but we can get more
No,
from
Belmont I know, but Sync Group, I guess, and you're telling me.
Think Group is the research group.
Right, that's what I just looked up. That's what, but they didn't have any information regarding who they are.
Okay, we can get that to you.
And so to me, that goes to the question of ability to target in and hone in on the specific demographic that we're looking for to respond, which ties to Shannon's question. So if you don't know, to ask, what about the newly arrived, as opposed to those that have been here historically, because we've been in place for 20 years, and MAP has been in existence for a lot longer than that, then I have a question. So anyway, I would like to see those questions answered. Thank you.
And just going back to the initial piece of the research, this is a survey of all Travis County residents. The survey was in October 24. We didn't ask if you'd been here for a year, a month, or a day. And we sampled for our patient population. Thank you. Go ahead, Dixie.
Okay, great. Let's advance to, yes, this slide here is perfect. In terms of awareness by race and ethnicity, we see the largest jump in the Hispanic Latino audience at 12 percentage points, reaching a high of 31%, thus having the highest level of awareness. However, the white Caucasian segment is not far behind at 26% awareness, a 9% increase from the previous wave. The African American segment's awareness remained fairly flat and trails at 18%, which is within the margin of error. Next, we looked at income and awareness for both those at or below 200 FPL, as well as those above 200 FPL. On average, awareness increased 6 percentage points, which is interesting. But more telling is the fact that, if you'll advance, awareness has been steadily increasing among our patient population. You can see here with awareness at 45% for patients, a 4% increase. This is huge, as these are the folks that are the target of our communications and recipients of our care. Of course, we have other target audiences, like we talked about, the taxpayers of Travis County, et cetera. But it's really important that we do see upward movement. And even with non-patients, we also saw an increase of 7 percentage points, peaking at 15. Next, we're going to move on to the phone interviews. We're mindful of the digital divide to ensure we captured people with no internet access. We conducted interviews via phone among MAP members in additional languages, Arabic, Vietnamese, and Burmese, with 5 to 6 participants in each language segment for a total of 17. The interviews were conducted with the goals of really getting an understanding of awareness of the central health system and MAP, and that MAP is provided by the central health system, perceptions of central health and MAP, and messaging preferences in residents. The interviews followed suit of the online survey for the most part. Breaking down the awareness and perceptions by language segment, for Arabic speakers, the fact that MAP is provided by central health is high, which makes sense as this is a MAP study. Perceptions were good for MAP and central health, but there's an opportunity to increase awareness of central health for this particular segment. Awareness of the central health system was really high for Vietnamese speakers, and this is important to note. This is an anomaly among all the research, both online survey and language segment interviews. So again, really seeing that high level of central health awareness is very important. Awareness that MAP is provided by central health was also very high for Vietnamese speakers, and perceptions of both central health and MAP were good. For Burmese speakers, more than any other group, central health perceptions are excellent. So in other words, there's a great opportunity here to increase awareness of central health, which is currently low, as this language segment tend to be big fans of Central Health. Awareness of MAP was high and MAP perceptions are good. One thing that's important to note is that the majority overwhelmingly supports Central Health's mission that everyone should have access to health care, no matter how much they earn or where they live or where they're from, and that access to health care is a basic human right, similar to the findings of the online survey, which is the impetus for some of the mission-centric messaging and as well as the sustainable awareness campaign that you'll see throughout 2025. Do we have additional questions?
No additional questions.
Okay, I think with that, we'll move on. And we're gonna sort of wrap things up here. There are a couple more slides that go in more in depth about our plan for next year. Can you go quickly to the slide? You can see patient outreach continues the entire year, as does government relations, community engagement. We took a break for advertising on the brand awareness, but we picked that back up in late December, and then internal communications all year. Perla mentioned earlier, our strategy this year for our community conversations is to partner with elected officials, Travis County commissioners, and host a community conversation in each precinct. 2 of those have been scheduled, and there are 2 more to go. I think, and with that, we can wrap up and take
Invitations have not gone out, but they will be going out soon, and you will be receiving them in your inbox.
Thank you so much for that very informative talk. Yes, Manager Valadez?
I know one of the things that we had committed to with the commissioners is having an executive session with them as a board. And they also wanted to include community care in that. And I know that was something that was discussed during the budget process of 2024. And we're going into 25, and I'd like to know if that's going to be scheduled soon, because I think that will inform a strategy for us. And second, also our own communication and meeting with the Community Care Board. Yes?
I'll ask Perla to speak to this, but I'm sure that if and when the Commissioners Court invites us to speak, that we will. Do you want to speak to her question about the commissioners? Is there anything to say?
I haven't had any communication from Judge Brown's office about that, and he sets the agendas. So, I'm happy to just check in on that, but, it's up to him I know it may have come up, but it's, he sets the agenda, so we have to kind of take his lead.
I appreciate that, but the reason I'm asking, and I'd like for us to take the lead in that, is because we're bragging to the public that we are being assertive and proactive in our reaching out to the public, and I'd like to make sure that Central Health is also taking care of business.
Thank you. And Mr. Duncan?
Yes, thank you, Chair Brinson. Regarding the question of meeting with the commissioners in closed session, under the Open Meetings Act, that is very difficult to do. You would have to post a meeting of your board, and then the subject of the closed session would have to be something where the 2 entities have a shared interest in order to support that closed session. I will tell you that's close to impossible. And if it's attorney-client, it is impossible.
I understand. It was just something that was brought up during a public meeting at Travis County by the commissioners.
Yeah. Okay. I think it sounds like just a follow-up. Okay. Thank you.
Thank you so much. Any other questions?
And the one about the CUC?
Manager Jones?
Yeah, is it possible to get a profile?
I thought you were finished.
I can speak to the second part. You had asked about our board's communication with the CUC board, right? Yes, we have a special call meeting on the 27th. It was just sent out earlier today. We will use that time. We'll use that time to update everybody about our discussions in relationship with the CUC board. Okay, thank you.
Yes, and Manager Jones?
Just a quick, is it possible to get a demographic profile of the staff within central health and perhaps community care by race and ethnicity of the outreach staff, not the entire staff, those who are actually engaging with the community themselves? And the second part of that is the leadership of that group. I'd be
I
interested
would
in seeing.
think so. I know HR presents to you on the demographics of the organization, so I think that would be easy to pull the demographics of our specific outreach teams.
I'm not saying they haven't, I just don't recall.
No, I don't know if we've
break it
broken
down.
it down to that level, but
Yeah.
I don't see why that would be a problem.
Okay,
Yeah.
if I could get that, I'd appreciate it.
Jeannie's giving me the thumbs up.
Okay, thank you very much. Thank you.
Appreciate it.
That's okay.
I'm sure they'll do it. Yeah.
Just very quickly, my follow-up was, we had, and I think I've mentioned this before in the past, and I apologize for having missed some information. I know that one of the things Susan Willers was going to give us before she left was organizational breakdown of staff, demographics, but also employees, and I asked for their responsibilities and their income. And I'd like to know if we're ever going to see something like that, because I don't think we've seen it yet.
We'll follow up on that. I don't know that that's, you're talking about across staff, right? Yeah, that would not be their responsibility, so we'll follow up on that.
All right. So moving on, there is no motion needed for this item. And number 3, receive and discuss a presentation on Central Health strategy, execution, and measurement. And Kim Heinonen will be presenting.
Press this. Can you? Okay, thank you. So one of my top priorities this year is partnering with Monica and her team on strategy execution. And my presentation is about a system that most leading organizations use today on managing their operations, managing their organization. And I would recommend that we take a look at it and maybe start using it here at Central Health. So next slide. So different approaches on how to execute strategy. So approach number 1 is top-down. So you have a senior leader who solves problems by himself, herself, and there's very, very little ground-up effort by staff. So few people solving few problems. So the bubbles represent the problems. Next slide, please. Henry Ford was a person who used this leadership approach very, very successfully. And his vision was affordable transportation for the masses. So transportation equity, if you like. And he made a mistake. He decided what the buying public needs, what they want, and he built a very, very efficient manufacturing system to the point where the T Ford that stayed the same for almost 20 years cost $260, and that was about a 3-month pay for your average factory worker. So he accomplished his mission, and because of him, all of us can afford an automobile. So he was a true innovator at his time. Next slide, please. Then there's approach number 2, where the leader, actually creates problems for the organization in terms of challenges, and he challenges the entire organization to solve problems. And this was very, very innovative 100 years ago. Next slide, please. And why would you do this? Because, if you're a senior leader, you only see a few problems. You only see the top of the iceberg. And most problems in an organization are down in the front lines. So if you truly want to succeed, you have to understand what the problems are all the way from bottom up. Next slide, please. And this was the approach used by Alfred Sloan. So he was in charge of General Motors from the 1920s all the way through the 60s. And his approach to executing his vision was to set objectives for the organization. So unlike Henry Ford, he decided that my objectives are going to be, we need a vehicle for every pocketbook, planned obsolescence, so every year we have to come up with a model change. Unlike Henry Ford, the car stayed the same for 20 years. Periodic payments, GM finance, so we can loan money to buy a vehicle. And then technical innovation. Next slide, next slide, please. And then he turned those objectives into goals. So objective number one, a vehicle for every pocketbook, he turned those into goals. A lineup of passenger cars for the wealthy, and then for the working class, cars and trucks. Next slide, please. And this was the GM lineup of cars in 1926. So you had Cadillacs, Buicks, Oldsmobiles versus the Ford. And if you have a choice, of course, you're probably not going to buy a Ford product. And that's exactly what happened. In 1927, the Ford Motor Company was in financial trouble. Next slide, please. So the way he worked was, he didn't have the answer. So what he did was he delegated authority and responsibility to, for instance, the person who ran the Cadillac division. So the head of the Cadillac division took Alfred Sloan's goal, turned that into his objectives, and came up with his own goals. Next slide, please. Same thing, for the gentleman who ran the Chevrolet division. Alfred Sloan didn't meddle. He let the objectives, lead the individual in charge. Next slide, please. So, Peter Drucker, who's considered the father of modern management, he took Alfred Sloan's approach and called it management by objectives. And he published that in 1954 in his book, The Practice of Management. And what he says that a leader's, a manager's role, really two roles. You set direction for the organization and you offer support and help. Next slide, please. And what is an objective? So in his book he writes, an objective can be compared to a compass. So if you're a ship's captain, the compass tells you to go in a straight line, but you can't do that. You have to navigate through hurricanes, stormy seas, and rocky shores. So that's really what a leader's, a manager's job in an organization is. You set an objective or direction, but you cannot go in a straight line because you're going to be faced with problems every single day. Next slide, please. So what's the main concept? Well, the main concept is that everybody knows the direction, everybody knows the plan, and everybody has a plan for the plan. So the idea is that if everybody executes on their plan, the organization will achieve the organization's plan. Next slide, please. So Peter Drucker, there's a saying, right? Nobody is a prophet in his own land. And the Japanese, after World War II, respected the gentleman immensely. And Toyota, of course, now, took what they learned from Ford and GM, and now they have become the market leader in the automotive industry. And the name for their MBO program is Hoshin Kanri, which means direction management. And that's how Toyota runs the organization. There's 370,000 employees, and everybody participates. Everybody is a problem solver. And that really is how they've become the market leader in the automotive industry. Next slide, please. So fast forward a few years. So this is now, we're in the 70s. And Intel, which is a Bay Area company, used to make memory chips back in the day. They got into trouble. Japanese competition were taking market share. And the gentleman in charge, next slide please. His name was Andy Grove, and he decided that we have to get out of the memory business and go into the microprocessor business. He never transformed an organization. He didn't have a clue. So he contacts Peter Drucker and says, you know what, I need some help. What do you think I should do? And he says, well, you should try this, management by objective system. And that's exactly what he did. Heavy resistance from the organization, but he stayed the course. And you could argue, thanks to this gentleman, we can all afford our little handheld devices today. So really, technology equity, if you like. So without this gentleman, we wouldn't have our handheld devices, our mobile phones. Next slide, please. So what is, the OKR system then? So an objective defines, what we seek to achieve. So where are we going? So the destination, the port, if you like. And then the key results are how we're going to achieve those objectives. Milestones that tell us, if we're getting there. Next slide. And, the kind of the linkage between, the strategic thinking between top management and then the individual's responsibility is very, very clear. So the individuals are actually the ones delivering the goods. And the leader just, sets the direction, the objectives, and gives total trust and autonomy to people, down the line. But of course, you have the responsibility individually to then, achieve your own objectives and key results. Next slide, please. This gentleman, his name is John Doerr. He worked for Andy Grove for years and years and learned the system. Went to work for Kleiner Perkins, a venture capital firm in the Bay Area. And they fund startups. And most of the tech startups are funded by Kleiner Perkins. And John Doerr's mantra is vision is important, but so is operational excellence. So typically a company founder has a vision, but he's never managed. He hasn't run any operations, so he wouldn't know. So what Kleiner Perkins says is, you know what, we're going to fund you, but you have to implement, you have to adopt our management system, our operating system. If you don't, you will not be successful. So it's kind of like two sides of the same coin, vision and operational excellence. You will not be successful without one or the other. And that's kind of how, Henry Ford failed. He excelled in operations, but his vision for the time was wrong. The same thing really happened to GM. The vision was correct, but they failed in operations. So Toyota took over. And now if you read the press, Intel is in trouble. NVIDIA has completely made them irrelevant. And again, operationally, they were excellent, but their vision was wrong for the time. Next slide, please. So in 1998, John Doerr gets wind of these two gentlemen. They have their office in Palo Alto in Sergey Brin's girlfriend's parents' garage. And he sets up a meeting with them. And, this is, their vision, organize the world's data and to make it accessible to everybody. So this is, again, these two gentlemen were about data equity. And now we know, what it's like if everybody has access to the world's data through our handheld devices. Next slide, please. And he shows them, this is an internal Intel training slide. So he shows them this slide to explain the system of OKRs. And it's really small. I don't know if you have the presentation there, but kind of how the story goes is, if you're the general manager of the San Francisco 49ers, you have an objective to make money for the owner, and you come up with two key results. You have to win the Super Bowl and fill the home stands to 90%. Well, you can't do that alone, so you're going to win the Super Bowl to your head coach. He's going to take that objective and turn that into his own goals. So offense, defense, special teams. And of course, he can't do that alone, so he delegates those down, to his offensive coach, takes that key result, turns it into his objective, and so on and so forth. So all of these objectives and key results are cascaded throughout the organization. And the only thing you need to do is to focus on your own little piece. And if you do that well, if you execute well, the idea is then the organization wins. No, he has no. That's why I thought first, because we're in Texas, I thought I'd put the Cowboys up there, but no. Jerry Jones's leadership is Henry Ford's leadership style, unfortunately. He has not learned over the years. What? Exactly. So that's kind of a telling. That's kind of a telling. Yeah. So anyway, so John Doerr offered the Google founders $12 million, and this is an interesting quote. So, well, we don't really have a system, so this might as well be it, and the rest is history. And that's how Google is run today. Most of the high-tech Bay Area companies. That's how Kaiser Permanente is run. And it's a very, very powerful way of running a business. Next slide, please. So why would we want to use this? Well, it's about communication, focus, discipline, and then metrics. Next slide, please. Next slide. And we would have these, organization, department, and personal level. And you would actually be able to tell what each person is working on. One of the ideas is to make it transparent, so there's a place where you can actually see the whole system. You could visualize it, and you can see who's working on what, so there's no duplication of work. So on the leadership level, big picture, and on the individual level, kind of minutia. Next slide, please. The process looks like this. We cascade these down in staff meetings, and then there's one-on-ones between leaders and staff. Next one. And some of the keys. So these are not just annual. We set them quarterly and annually. They have to be measurable, and then they are graded each quarter. And of course, as I mentioned, they're visual, so everybody can see what each individual is working on. Next slide, please. There's a timeline. Next slide. Some of the elements, the objectives should be uncomfortable. So, the idea is we stretch the organization, because if you don't stretch the organization, they'll never learn. So it's like, going to the gym, if you're lifting, just light weights, you're not going to gain strength and muscle. So if you want to gain strength and muscle in the organization, you have to make sure that people are a tad uncomfortable. And key results, it is not a key result unless there's a number to it. So there always has to be a number so that you can objectively grade them. Next slide, please. And then some basic hygiene. So max 5 objectives at the top level with 4 key results. And typically, majority of the objectives should come from the bottom up. So it's not, a top-down approach. It's top-down, bottom-up, where everybody has a voice. And no dictating, so we have to mutually agree on what we're going to be working on. And ideally, it's a one-pager, so that, it's easy to understand. And then it's not a performance evaluation weapon, so they're graded. The idea, if you reach, let's say 60, 70%, you did a good job. And that's kind of that stretch where we make people uncomfortable. So it's fine not to reach your key results. Because if you reach 100%, you're sandbagging it. You're making it too easy for yourself. Next slide, please. And the end product is that everybody is working towards the same results. We're focused, and we're coordinated. And everything's linked from top to bottom, from bottom to the top. Next slide, please. And here's some steps, how you go about doing that. So every year you brainstorm, you set the objectives, you set the key results, you assign teams and owners, and you track progress. Next slide, please. So brainstorming, this is how you would do it. So what do we need to accomplish in 2025? What are the most important things? This is key. What are we going to do in 90 days? So these are kind of like sprints. So in the in the high-tech industry and software industry, they call them sprints. So we shrink the objectives, the goals, to something we can quickly achieve. Next slide, please. So objectives, what we seek to achieve, they should be very concrete, action-oriented, inspirational. And each level should have about, 3 or 4. So you can imagine the number of, so if there's about 2,000 of us here in this organization, the number of objectives and key results, when you really would, visualize it, would be quite astonishing. Next slide. And key results, we all heard about SMART goals, so that's kind of the same thing. And each objective should have about 4 to 5 key results. Next slide, please. Every OKR should have an owner. They're team-based, or they would have individual owners. Next slide, please. And then we track progress. So in staff meetings, one-on-ones. And this is, when we talk about kind of a, if I'm, when I'm reporting to Pat, we would have kind of a coach-coachee relationship where, I have these on a piece of paper, and he would ask me, Kim, what's your, what are some of your objectives? What are the obstacles? How can I support you? So we would, kind of have that coach-coachee relationship, a helping, trusting, mutually respecting, helping relationship. Next slide, please. So, it could be, how do you organize this? It could be on a piece of paper, just bullets. Next slide, please. Or it could be, some sort of template. And, with some sort of color coding. It doesn't really matter. And next slide, please. So this, if you, we all have used Google Maps, and this is where the Google Maps idea came from. So, you just plug in your destination, and you click on the directions or start, and it would actually populate it with the key results. And the only thing you need to worry about is the first one. Take a right turn or take a left turn. It has a time and a mileage to it, right? And kind of the same idea. I will gradually, if I reach this milestone, I will eventually, ultimately reach my objective. And what happens with Google Maps? So think about kind of the coaching relationship. What happens with Google Maps if you take a wrong turn? It corrects you, yes. So it's kind of like a virtual coach. A little voice comes on and says, constantly keeps you on track. So that's kind of the idea. Is you have support from your leader, and in this case, you have the virtual support from the little voice that comes on and talks to you. But this is kind of how this innovation came about, from the OKR process. So it's interesting how small things can turn into very, very big successful endeavors. So this was my last slide. So any questions? I was about to rapid fire. I'm sorry, but thank you.
Any questions? Manager May, any questions?
No questions. I like the presentation.
Thank you.
Manager Jones?
No questions. I concur.
Manager Matwani?
Thanks, Chair. I'll try to keep my comments as brief as I can. No questions. Just really appreciate this management framework and have used it multiple times. In fact, was introduced to it here when I was COO at the United Way by Mason Air, who's the head of Kirby Lane here in Austin. And though I don't think the organization adopted it to the point of necessary exemplary status, the organization did adopt it, and the organization did approve. And certainly in the operations team, we really took it pretty seriously. And it's amazing how such a simplistic seeming framework can empower a team to accomplish effectively anything. Once you've set a top line goal, we want to historically improve health equity in Austin, Texas. And we're saying, okay, wow, what a big, hairy, audacious goal. And, what are the key results? We want to, and, to take some words out of Dr. Lee's mouth, reduce health disparities by 50%. Okay, well, what are the key results going to be? As measured by what? AMB what? Well, we want to see reduction in, tobacco usage, in these particular areas. We want to make sure access has improved in these particular areas. We want mortality to have improved in these particular regions, et cetera. And so you make sure that we're working on those indicators, and it keeps our eyes on the ball. So if we have like 2 or 3 or 4 of these key objectives that as an organization we're going to achieve, we all keep our eyes on the ball. And the way that cascades through the organization, key result 1 becomes the next person's objective in the reporting line. That keeps us all oriented. So every one-on-one meeting can really just be, how are you on your OKRs? There's a section on that. Hey, I'm green here, I'm green here, I'm kind of yellow here. Let's talk about that. Let's see what kind of support we can get. And then there can be another section for personal things or for something that's outside of the OKRs. Hey, we want to put this into the pipeline or into the roadmap, what have you. But everybody knows their place in the organization and what that does, not just for efficiency and actually achieving the goals, but for getting buy-in from every member of the organization all around. And every member has purpose and also has the transparency into how that purpose feeds into the overall vision is helpful. And I think, as a board manager, I would benefit greatly from feeling this involvement here at the board level. And I think that, it can even orient us to a point where, not that this happens, but hypothetically, in boards you'll see, oh, well, we missed the $7 million, or $7 million was supposed to be here at this time, it wasn't here, right? Why? Well, we didn't have the fiduciary or the financial sort of efficacy objective that we were following. We took our eyes off the ball and we were over here. Why didn't we achieve the build out of these 4 projects? Well, because we were talking about these 7 other things. Why did our agenda, why was our agenda too long for the day? Why couldn't we cover all the items? Well, because we had so many important things to talk about that we weren't able to get to everything. When we have a map and we can see, we're like, okay, we're talking about this right now in the global map that we all agree on. When we talk about this and we switch to this, we're sacrificing this, and we can all agree that we're sacrificing that, then it keeps us all on the same page. And we know, okay, well, we need to edit our roadmap, et cetera. Because in the stations that we're in right now, it's true. Everything we talk about is important. And anything that comes up is important. And anything that a patient might bring up is important and deserves the airtime, right? Invariably, we're going to have to make sacrifices. But I think to move forward, to build the end-to-end high-quality operating system that Travis County patients deserve, and to do also right by the stakeholders who pay into the system, both patients and non-patients, I really do think that this process will get us there. And it takes a while to get it implemented in the beginning, but I'm bullish on the idea. So thank you for the presentation.
Yes.
Thank you. I appreciate this. I'm hearing this as something I guess Dr. Lee is putting into place for your operations and with your help and others, and that sounds very good. And it's very helpful for us to hear how you all are operating as staff in carrying out the board's objectives. So we have a couple of things to do still as a board to get on the same page, and that's the top line, in terms of setting the key objectives. So I heard the board in our last conversation about our need to have a retreat to set those key objectives. So we're in the process of, and I'm working with, Perla and Brianna and Dr. Lee and everyone to find the time to do that, because we need to do that in order. What you're showing us in OKR depends on, at the top, you've got that work done, which we don't have that work done yet, and we don't have that work done yet in a way that we're all on the same page. So that's work for us to do shortly. We'll get to that. The example you gave is great, you know, in terms of how we operate. We operate as a board. OKRs for us as a board is not quite the same as it is for staff. The analogy that you mentioned in terms of how we handle our board meetings is something that we need to do and we're working on right now, you know, in terms of, as you can see, we've got agenda and timelines. And, you know, in a very simple way, if you think in terms of, well, did we get through our whole board meeting? You know, no, if we're not following our timelines, which means we're going to be running a little late, short in a minute, but because this timeline takes us past what we're supposed to be at. But regardless, that's something we'll work on together because, as you mentioned, we have to consider how we handle our time. So I'm going to be sending out a survey to everybody to just ask y'all a couple of things in terms of your ideas about we've made some progress, you know, in terms of having these timelines, but there may be some other things that we need to do in order to manage our board meetings better. So I'll send that out. But this is very helpful, and I appreciate your the way you presented it. It's very understandable and very helpful in terms of understanding what makes success for a board and a whole enterprise, and what helps a management team led by Dr. Lee to have success in carrying out the objectives that we develop as a board. And it can be instructive, as you said, for us, you know, in terms of how we operate, and so we all know what the objectives are and stuff like that. So
Thank you.
Really appreciate it. Thank you.
Just in the nick of time, so that was great.
Thank you.
Yes.
I greatly appreciate this because it shows me how we are not operating. And I think not through intent, you know, because I believe that the road to hell is paved with good intentions, and we're getting there. Not to hell, but to the good intentions part. Sorry. But I do think that as our chair said, as Amit said, I guess because there were not very many comments from anybody else, but beginning with trust is the most important thing. This has been a challenging year for us. It has not been a trustworthy year for us. And I'm maybe it's my perspective, and it is my perspective, but I'm allowed to say it. So this is a good opportunity for us to look at what is going to be implemented at Central Health. And if that is being implemented, Dr. Lee, then how it's going to work for you to be able to evaluate your team when things don't go the way they're supposed to go, and how that gets communicated to us, which is the most important thing. Are those results getting communicated to us? Because we're, as a board, the fiduciaries responsible for how our tax dollars are spent, and we ourselves have to have a vision for making sure that our team, which is the staff, is getting us there, for achieving what our vision is. So thank you for giving this to us. And this is going to serve as this year has proven to be, or at least the last 6 months, a major wake-up call. And I appreciate your support, and maybe you can give us
Thank
a
you.
lesson.
Yes.
Thank you.
And to meet our objectives, we're going to move on. So,
Okay.
Yeah.
Thank you.
Thank
So-
you. I didn't take as much time as the meet, but that's okay.
number,
May I offer just a very brief comment, Dr. Brinson?
Very brief so we can meet our objective.
Yes. Well, I wanted to thank Kim. It's a gift to have Kim here. He says this very low key, but he helped Kaiser Permanente, Northern California, one of the largest part of one of the premier health systems in the world, do this. And because his granddaughter is here in Austin, we have the privilege of having Kim help us do this. So that is an enormous privilege. Vision is important, so is operational excellence. And the two together lead to sustainability. So I want to make the point that what we are embarking on is a very difficult journey. Healthcare finances are grim. and in the safety net, they aren't about to get a lot better, for referencing some of what you said, Manager Valdez. So it's our responsibility to ensure that we are as competitive in every respect as we can, and the ability to link the entire organization, drive to goal, without wasting our effort, duplicating, and making sure that it all kind of makes sense. You got to be able to read the story of the top level objectives and the cascading key results objectives all the way to the front line, like you did for the SF 49ers version. You're like, oh, I get it, right? We pass, we don't get interceptions or fumbles, we don't give up special teams, we win the Super Bowl, right? We fill the stands. I get it. And that is part of what we want to provide to you, to the Board of Managers. I want you to be able to see how we take the broad direction and break it down and where we're going and how we're doing. And if we do that effectively, it will give us an edge in being able to get more, spending less, right? Move faster, pivot faster, right? So this is very much mission critical, in my view, our ability to be operationally excellent. And really, what does that look like, right? Not just, it's nice words, right? But what does that actually look like? And so that's our commitment to bring in, we got lucky, bring in the best of the best and have Kim teach us and have us put this into practice this year. The early wins for trust were a very light version. You could think of the name of the win and then the way we measured to it as objective key result, right? So we did this for 6 OKRs last year. We didn't have the wherewithal to cascade this through the whole organization. That's why we hired Kim. Now that we got Kim, you're going to see us take another swing at that and a much more profound swing at that. And so looking forward to the opportunity to share some of that thinking very shortly with you all and appreciate the opportunity. Thank you.
And so no motion is needed for this item. Item number 4, receive an update on Central Health substance use disorder and opioid abatement funding and strategies, as well as collaborative efforts with the City of Austin and Travis County. Members, there will be no presentation on this item. Materials are in the backup and staff are available to answer questions. No motion is needed. Number 5, receive an update on the Central Health dashboards associated with service level reporting for fiscal year 2025. Again, members, there will be no presentation on this item. Materials are in the backup and staff are available to answer questions online. So I'm going to read items 6 and 7. I announce that the committee is convening in closed session to discuss agenda item 6 under Texas Government Code 551.071, consultation with attorney. Say that again? Read the item. Okay. Number 6, receive and discuss an update on Central Health's enrollment into Medicare and Medicaid programs. And 7, receive an update from council and discuss the impact of certain state and federal policies on MAP membership. What we were thinking is that we would do number 7 first, because this is what's going to take the most amount of time, and then go to number 6 if there is time, and if not, we can postpone that. Okay? So, again, we're moving into closed session. Agenda item number 6 under Texas Government Code 551.071, consultation with attorney, and under Texas Government Code 551.085, governing board of certain providers of healthcare services, and agenda item number 7 under Texas Government Code 551.071, consultation with attorney. The time is 3:30. The date is January 14th, 2025.
Whenever you're ready, Chair.
Okay, we are moving into open session. It is January the 15th, 2025, and the time is now 4:25 p.m. Managers, our next Central Health Strategic Planning Committee meeting is tentatively scheduled on Wednesday, February the 12th, 2025, at 1 p.m. at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. At this time, I am ready to accept a motion for adjournment. Manager Valadez, do I have a second? Yeah, Manager Motwani, and agreement, everybody who agrees, say aye. Aye, okay. Thank you all very much.